Hi guys, it's me. First of all, I'd like to say Happy Tourette's Awareness Month. Tourette's Awareness Month is from May 15th to June 15th. We have a whole month dedicated to us, so I'd like to congratulate everybody that made that possible. So, good on you guys. I decided to jump on the bandwagon. Wait, quick. Dog. I decided to jump on the bandwagon and I am doing a Tourette syndrome awareness video. You betcha. Because I am a horrible rememberer of facts, I've got mine written down here and the other page. So, let's get this shindig started, shall we? Okay. What is Tourette syndrome? Tourette syndrome is a neurological disorder which is characterized by repetitive, stereotyped, involuntary movements and vocalizations called tics. It is named after Dr. Georges Gilles de la Tourette. He's a French neurologist, and I said it in a French accent because I don't know how to say it, and I was hoping it would distract you from that fact. Obviously not. Well done, guys. You're on your A game today, tonight, yesterday, tomorrow. Depends on where you live. Tics. Now, there's 4 ways to describe tics. First, you've got your simple and motor tics, and then third and fourth of all, you've got your vocal and your motor tics. Excuse me. Let's start off with simple tics. Simple tics are sudden and brief. Okay, these are some of the most common tics. I'll move it because that's the kind of person I am. These are some of the most common tics. These are motor. You've got your eye blinking, which can be like that, or it can just be blinking a lot. You've got your facial grimacing, which is things like that. And you've got your shoulder shrug, so you can either do a shrug or you can sort of things like that. And you've got your head and shoulder jerking, which can be like things like that, or it can be something like things like that. Your simple vocal, you've got your sniffing, so it can be like, or out the way, things like that. Or you can do grunting. How to explain grunting? Like I don't have any grunting tics. I just have this one where I kind of imitate a pig. One of my tics stopped that from coming out. Thanks, guys. Your grunting can be like mine, where I snort like a pig. Rare occasions though, because pig doesn't really come up in the conversation that often, and I don't get affected when you say pork or bacon. At least I'm hoping not. We'll see how that goes. Only just occurred a couple of days ago. Back on topic. And throat clearing, things like things like that. Very simple. And those are the most common ones. So there are many out there, so don't just think that's all it is. Okay, complex. It's going to seem complex, but really when I tell you, it's not actually that complex. So complex tics are distinct and coordinated patterns of movement. That's it. Okay, so we've got our motor tics. You've got your facial grimacing combined with a head twist and a shoulder shrug. It's like a dance move, like a tricky dance move. Although you kind of look a little spastic. I'm allowed to say spastic because I am spastic, and it's only okay when I say it, or other spastic-like creatures of my being do. Your vocal. They are words and phrases. So some of the two sort of common vocal tics are echolalia and coprolalia. Echolalia is the repeating other people with their words or phrases, things that they say. And coprolalia is, of course, the swearing. That, unfortunately, for you people out there whose hopes and dreams are crushed, is not what Tourette's just is. It only affects 10 to 15% of people with Tourette's. That's not a lot. That is really rare. And the only reason people think that's all that Tourette's is because that's all the media shows. Like an episode of South Park. Hilarious, but a little offensive. It's just, you know, people like twitching like that and then just swearing like bad words. So not the best way to let people know about Tourette's, but that's why we have this month, so we can tell people on to more topics. They're often worse with excitement or anxiety, and I know that's me. Definitely my excitement levels really high, tics really high, really, you know, anxious, really high. When I talk about it, sorry if that was a bit loud. I don't know how loud that's going to be, but we'll see. When I talk about it, they come out a lot, which is why I tic a lot more in my videos than what I actually do. And because when I'm out in public, I try to control it. They wax and wane. That means that there is no set timetable to a tic. You can't wake up one morning, open a book or look at your calendar and think, oh, I've only got 4 tics this morning. This is going to be a good day, you know? That's not how it works. It's random. You can have, 4 months of tics constantly occurring, you know, one after the other, or it can be like one every minute, you know, just randomly all bunched up like that. And then after that, you can have a year and a half, 2 years of just, you know, pretty normal leveled kind of tics, you know, nothing big, nothing, you know, just, you know, normal. I'm hoping that squealing one doesn't stick because that's the first time it's ever happened. Live for you guys. Not all people can suppress them or camouflage. I camouflage my nose tic by doing this. So this is my nose tic. I camouflage that by doing things like this. Or I just go, oh, my nose is itchy. Or I'll just be like, Very interesting topic. I'd have to say that leprechauns do exist. Something like that. And they do, by the way. Not everyone can do it. Some people, like myself, the longer I hold a tic in, the bigger vengeance it's going to have coming back out. So it's better to just let them go. Okay. Almost finished, guys. What causes Tourette syndrome? Okay. It's basically abnormalities in the brain. You've got them in sort of in your basal ganglia, your frontal lobes, and your cortex, which I'm going to guess is the middle of your brain. If I am wrong, damn. Okay, they are basically misfiring of neurotransmitters, and your neurotransmitters are dopamine, serotonin, and norepinephrine. Zwei, drei, vier, fünf, sechs, sieben. That's German, but I don't know. They're basically responsible for the communication among nerve cells. Some associated disorders, diseases, whatever you want to call it, that come with Tourette's. Not everyone has them, not everyone has all of them. Some have a combination, but you know, depends on the person and the case again. You've got your OCD, which is obsessive compulsive disorder. You've got your ADD, your attention deficit disorder. You've got your ADHD, your attention deficit hyperactivity disorder. Tongue twister. I worked out and it really hurts there. Ow. There's depression and anxiety disorders. A diagnosis for Tourette's. You must have both motor, multiple of motor, and at least one vocal tic for at least 1 whole year. 12 months. Gotta be 12 months. You cannot go without a single tic for longer than 3 consecutive months. If you have tics for 4 months and then no tics for 5 months, it's not Tourette's. It's probably a transient tic disorder. It must occur before the age of 18. That is the onset of Tourette's. I'm currently going to find out if I have Tourette's. I am going to ask my doctor because I have had both motor and vocal tics for more than a year, and when it started I was 16, so you know, I'm turning 18 this year. I really want to find out what's going on. Okay, actually I think I was 15. Anyway, just turning 16, whatever. Okay, it's a genetic disorder. It is not contagious. If I sneeze on you, or someone with Tourette's sneezes on you, you're not going to catch it, okay? The only way you can have it is if you were born with it. Your parents may not have Tourette's, but they can be carrying the Tourette gene, okay? If you have a child and your first child has no tics, nothing like that, your second child can have a high chance of Tourette's. At least I think that's how it works. I don't know. I haven't really asked the guy in the sky. Shut up, leave me alone. Go away. Sorry. If you believe in God, there is no cure, only medication, okay? You cannot cure it. You can have medication that can sort of lower the severity of it. I'm on clonidine. It's basically a muscle relaxant, and it sort of, it relaxes me. Too much of it and I'm a little, so you've got to find that right level for that right person, because again, every case is different. Okay, so if you see someone or someone tells you, hey, hi, nice to meet you, I have Tourette's, don't think you're going to catch it, okay? You can't catch it. You have to be born with it. Do not assume that they swear. Not everyone swears. Very rarely will there be someone who swears. It's just highly romanticized in the media because that's the funniest part of the disease. Disorder, whatever you want to call it. So next time you find someone with Tourette's, just make sure you're aware, okay? So, thanks for watching. And you can subscribe. Check out my other videos. There should be some along here. That'd be really nice of you. You can actually comment. Let me know what you think. If anything I've missed that you feel that people should know, just comment down there and people will go read it and bam, spread awareness. So tell at least one person, because that one person will tell someone else. They'll tell someone else, someone else, someone else, and before you know it, a lot of people will know about it. So yeah. Pretty much good on you guys. Congratulations to all those with Tourette's on making it this far in life. I know it's hard, but we can do it. That was so gay. Anyway, peace out, guys.